Welcome. It's my pleasure to present the ReCONNET educational webinars and calendar 2024. I'm Maurizio Cutolo, and I present on behalf of Genoa educational webinar team, including Emanuele Gotelli, Sabrina Paolino, Elvis Ija, the Education and Training ReCONNET working group, co-chaired with me by Eric Haculla, and on behalf of our ReCONNET coordination and communication team, including Eleonora Passeri and Diana Marinello. This is a report of a call we have done in 23 for webinars 23-24. The call for proposal was launched on September 23, and anyone was admitted to support with suggestion for webinars. The deadline was on 31st October 23. Number of proposals received were 23, and 82% were accepted and entered in the program 23-24, which is the target audience of educational webinars. The healthcare professionals, including physicians, nurses, researchers, patients, as well as caregivers and family members of patients affected by connective tissue disease, rare connective tissue disease. Specific target audience can include also in peculiar cases, for example, general practitioner or other people interested in attending or producing webinars. The classical structure of an educational webinar includes an introduction by the moderators, usually one or two moderators, presentation by the speakers, usually up to 4 speakers in some cases, and question and answer for the online audience that is produce question that will be asked by the moderators to the speakers. The duration of the webinars in case of one speaker is 20 minutes and 10 minutes per question. The duration of the webinar in case of 2 or more speakers include 10 minutes for presentation for each speaker and 10 minutes for the final questions. It's important the whole webinar will be held on Wednesday at 4 p.m. and on the Zoom platform. Free online registration in any case are required to attend the meetings and the webinars. The educational webinar recorded in 2003 and 2004 included different topics like relapsing polychondritis, skin manifestation in dermatomyositis, multifaceted aspect of nutrition, and the patient and doctors win-win alliance, or treatment of idiopathic inflammatory myopathies, anti-nuclear antibodies, when and how to test them, and as well as refractory systemic lupus erythematosus for identification of best management and treatment. Then, at the beginning of 24, other topics included the characterization of pain, its management, young people with child onset of lupus, 10 questions on relapsing polychondritis, and juvenile onset systemic sclerosis in site of an orphan disease. What about the educational webinar 2024? In April, we'll start the second part with, as a topic, mixed connective tissue disease, then French practical guidelines for diagnosis and management of relapsing polychondritis, 23 ACR guideline for anti-phospholipid syndrome, update on hypermobility Ehlers-Danlos syndromes, everything you would like to about Ehlers-Danlos syndromes. A second, preconception care in patient with connective tissue disease, explaining systemic sclerosis to my friends, the optimization of glucocorticoid therapy in chronic treatment of connective tissue diseases, as well as how to explain antiphospholipids to my patients, multidisciplinary diagnosis or multidisciplinary teams involved in inflammatory myositis, screening and treatment of systemic sclerosis associated with pulmonary hypertension, as well as treatment of systemic sclerosis associated with interstitial lung disease. Where do we stand in 2024? The speaker of the webinar up to now produced include, and the future one, included 17 speakers female and 14 speakers males, as well as moderator, 10 moderators female and 10 moderators male from the different members of ReConnect. The registration links for the educational webinars are available on the website of ReConnect, and this is the website. And we invite you to use this link for a fast registration. Of course, it's possible also to observe and to have the possibility to look at the recorded previous webinar on the official YouTube channels. And this is the dedicated ReConnect official YouTube channels here you can see. So subscribe, please. In conclusion, of course, we would like to see you online, abundant, like in the past, and get in touch with ReConnect and ReConnect with both links. Thank you very much for your time, and see you soon on the new ReConnect webinars series. Goodbye.